Thank you very much, Madam Speaker. And through you, Madam Speaker, I have a couple of questions for the proponent of the bill.
Please proceed, ma'am.
The proponent stated that there are approximately 200,000 uninsured residents in Connecticut. Would the scope of this study also include looking at those Connecticut residents who are currently insured but lack access due to high costs and very high deductibles? Through you, Madam Speaker.
Representative Abercrombie.
Through you, Madam Speaker, I would assume that they would look at all aspects of insurance. Through you.
Representative Cheeseman.
Again, this is obviously going to be the scope of the study group, but through you, Madam Speaker, is there any idea given to how eligibility for any such program would be determined? Through you, Madam Speaker.
Representative Abercrombie.
Through you, Madam Speaker, we won't know that until the report comes out, which is due February 1st of 2019. Through you, Madam Speaker.
Representative Cheeseman.
Through you, Madam Speaker. So there, again, if I'm understanding this correctly, the study group will be given the purview to look at both a Medicaid option, a private insurance option, a combination thereof, or anything they deem to be in the best interest of ensuring those who cannot currently afford coverage. Through you, Madam Speaker.
Representative Abercrombie.
Through you, Madam Speaker, yes.
Representative Cheeseman.
Thank you. So through you, Madam Speaker, it's possible the study group could come back and say they should all be allowed to buy into our legislative health insurance. Through you, Madam Speaker.
Representative Abercrombie.
Through you, Madam Speaker, sure.
Representative Cheeseman.
Thank you. Again, obviously, we haven't had the report from the study group. If the determination is made that it should be through some form of Medicaid additional coverage, has the good proponent of the bill given any thought to the fact that we have a significant number of doctors who do not take Medicaid patients, and that might, although, again, providing insurance might not create the access needed? Through you, Madam Speaker.
Representative Abercrombie.
Through you, Madam Speaker, we have the most access to Medicaid through our primary doctors than any other state. Our cost is very low when it comes to, we're very lean in the Medicaid program, and we are considered one of the leaders. Our primary doctors have stepped up to the plate. We don't have an issue with access in the state when it comes to Medicaid, especially in dental, where we are #1 when it comes to access. Through you, Madam Speaker.
Representative Cheeseman.
Thank you. Through you, Madam Speaker. And I thank the good proponent of the bill for that. But if we're looking at adding 200,000, 500,000 people to the pool, I would suspect that would create additional pressure, particularly on the primary care physicians. And I just have a few comments. As the people in the chamber will know, I have personal experience, as does my son, of the unaffordability of health insurance now for many people if they don't qualify for subsidies. So although I welcome a look at what could be done to make it more affordable, I'm concerned that there may be a Medicaid option that may put additional pressure on the state. And I'm also concerned that we have precluded many of the avenues that would have reduced the cost of health insurance by mandating coverage. And I think the study group should certainly look at what we can truly do to offer choice to our citizens, many of whom want coverage, have bought coverage. One of the saddest stories I've heard relating to the Affordable Care Act, in conversations with an ear, nose, and throat doctor, she had a working mother, single, 2 children, with her Affordable Care Act plan. She came in with a lump in her throat. The doctor knew immediately that she should biopsy it because this was likely to be cancerous. The woman was a smoker. She said, look, you need a biopsy. The woman said, how much is it going to be? She told her, and she said, I can't afford it. You really need to have this done. The woman went away. She spoke to a social worker who basically said, look, she can get coverage. She's going to have to quit her jobs and go on Medicaid. The woman didn't want to do that. She liked being able to afford to feed her family, to set the example for her doctors. And that physician told me, the saddest part of this, Prior to the Affordable Care Act, she could have delivered charity care. She would have worked with the pathologist and the hospital to do the biopsy for free. But now that's insurance fraud. So that woman was faced with giving up her job to get the health care she needs. That's not the kind of system we should have. I will listen with interest to the rest of the conversation because I think it's an important conversation to have, but it is not a simple conversation. Thank you very much, Madam Speaker.